Let's get started with topic 3, which is precision RS mastery to guide the principle for the safe and effective medication safety. At the end of this topic, you will be covered the medication mastery to guide on the medication, data decoded guide on the patient data, prescriber compass to guide on the prescriber, and the last one, safeguard life to impact on medication safety and patient safety. So, globally, patient harm due to the unsafe medical care is the leading cause of the death and disability. One in the 20 of the patients will experience this preventable medication-related harm in the medical care. And it can be said that a quarter of their preventable harm will lead to the whether the severe or life-threatening event. Error can occur at various stages of the medication use process. Globally, most of the errors occur at the prescribing stage, which is comprised of 53%, followed by the monitoring stage, which is 36%. And in the lower middle income countries such as Malaysia, almost 80% of the preventable error they occur at the prescribing stage. So let's jump into the guidance on medication to prevent the error. In the WHO Global Patient Safety Challenges, Medication Without Harm, they identify 4 domains to guide on the medication safety, which is product quality and safety, naming, labeling and packaging, logistics, storage and disposal, and the last one is the right products at the point of care. One of the main causes of medication-related harm globally is substandard medication. The study have been mentioned since decade ago about implementing robust regulatory system and process will ensure that procure medication are safe. A well-functioning regulatory system and robust regulatory processes are necessary in order to address the issue of substandard and falsified medication. Second, education and awareness raising program are among the first steps in preventing the use of the substandard and falsified medication. Lastly, the quality control of the traditional and complementary products are also needed to be ensured for the safety. So under this subsection 2, which is naming, labeling and packaging, it's always being emphasized to ensure the clarity in terms of the labeling, packaging and availability of the patient information, especially during the process of registrations of the pharmaceutical products. Second, we always should focus to label the high alert medication and LASA medication for clear identification. For example, by using the Tolman lettering and auxiliary label. The confusing of deluxe alike and sounds alike LASA names, labeling and packaging are among the frequent sources of the error and medication-related harm, with the 6 to 14% of all errors mostly coming due to the LASA products. And the last one, as the healthcare provider, we always should use the generic name instead of the brand name, or indicate the name of the medical plants or the name of the organic plant included in the TCM products. This is to ensure the correct identifications of the active ingredients. This is the LASA pass identified by the Institute for Safe Medication Practice and the Tolman lettering with the capitalizations of confused letters that can be used to identify this medication accurately. The third guideline, including to store the medication according to the manufacturer's instruction and to maintain the cold chain specific to each of the products. And then we must store the high alert and LASA medication separately to prevent the error to further occur. And the last one, to dispose the medication and products according to the guideline that being given to the healthcare provider. And the last one, to make available appropriate medical products at the point of care for patients and to select the medication rationally according to the clinical practice guideline. Under this subsection, the first one, we must develop and have an updated essential medication list for the country. And the WHO model list for essential medication can be used for this purpose. Second, to prescribe appropriately in the context of multimorbidity and aging, and also to empower the patients so that the patient can also have participate in their decision making to receive the medication that they will be happy to use.